Alright, for our next video we're going to talk about how bones form and develop over time. So this is where we're going to talk more about cartilage. We're also going to talk about the two forms of ossification, and intramembranous and endochondral ossification. We'll talk about the epiphyseal plates, aka the epiphyseal line, depending on what point in life we're at. And then we'll also talk about modeling and remodeling as well. So when we look at bones, we don't start with bone when we are developing. We actually start with cartilage first, right? The cartilage acts like a template, and then we can build bone using that cartilage template. This is called ossification, right? The process of becoming bone over time. And there are two pathways to developing this bone. Intramembranous ossification, which is used in the flat bones, most of the bones that we find in like the cranial region and the clavicles, the collarbones. And the endochondral ossification, which is what we use for the long bones and the base of the skull. So if you've learned about one, like these pathways, you've probably learned about endochondral ossification. You might not have picked up on intramembranous yet. And if you don't remember either, that's okay. We're going to talk about both. So let's talk about intramembranous ossification first. And really the general thing is the same. We're starting with a cartilaginous base and we're building bone up. So in this case, we see mesenchymal cells and collagen fibers all around. We see an ossification center that has like a hyaline base. We see osteoblasts that are going to be building more bone. We then now have this circle of osteoblasts that have been created around osteocytes. We now have a more solid bone matrix on the inside. And then as we continue, right, the mesenchymal cells are going to form the periosteum, the living outer covering. Blood vessels are going to start to inch their way in, and all of these areas with bone cells are going to form the trabeculi. As we continue, we see our periosteum is now kind of a fibrous, mature periosteum. We have our osteoblasts lining the spongy bone. We now have a layer of compact bone, right underneath those osteoblasts and right above those osteoblasts if we're looking at the bottom. And now we have all the spongy bone on the inside with red marrow filling in the spaces between. Endochondral ossification, this is the one you're probably more familiar with. This is what long bones are going to use. We start with a hyaline cartilage base that is somewhat bone shaped. We then form what's called a bone collar, so we're starting to see the matrix calcify. We're seeing compact bone form a ring around the middle of our cartilage base. We then start to see spongy bone developing in that primary ossification center. A hollowing out is going to start happening as well, with a nutrient artery coming in to feed it. And we're going to work our way from the middle towards the ends. Now, as we work our way from the middle towards the ends, we will have secondary ossification sites start, which will build up the spongy bone in the epiphyses. And we're just going to keep doing this until we are pretty much all bone, with the exception of the articular cartilage that is forming the caps right at the very top and bottom of the long bone, and the epiphyseal plate, which will stay a little bit cartilaginous as well. In terms of how bones grow in length, this comes down to the epiphyseal plate, also known as the growth plate. You might see either term, so be familiar with both. But let's talk about what's happening there. Right, we have different layers or different zones of the growth plate. We have the reserve zone, the proliferative zone, maturation, hypertrophy, calcified matrix, and zone of ossification. So in the reserve zone, we have cartilage, right? This is where we're just producing some of that cartilaginous matrix. And then we get down to the proliferative zone. This is where we're just going to go through mitosis over and over and over again, just make more cells, more cells, more cells. We're going to go through a maturation hypertrophy process where we're now going to accumulate things like lipids and glycogen. The matrix is going to go from that semi-solid to a solid with calcium. Our matrix is now calcified. We can kill off the cells that we don't need because we don't need so many of them. Remember that bone generally doesn't have a lot of cells. And then as we get down here, we really replace that cartilage with bone, right? And so this is what's going to add length to the bone. So as you go through something like puberty, right, this is going to add length so that you get taller. Not only do your bones get longer, but they also grow in diameter. This is the remodeling process where we use osteoblasts and osteoclasts in tandem to break down bone from the inner medullary cavity and build bone up along the outer edge. And the idea is to widen the diameter of the bone. Right? We do that by breaking down some of that bone on the inside and laying down more on the outside, therefore creating a bigger diameter. Right? So the diameter of the bone increases, but also the diameter of the medullary cavity increases. This is how we go from having a really small, thin femur to the thick femur that you have as an adult. Right. Not only do bones have to grow, sometimes they have to repair themselves. So this is where we're going to get into what happens when your bones break, right? Something has gone wrong, some sort of accident, and so we need to be able to fix those bones, and we have a natural process to cause that repair. We're going to talk about some of the different types of fractures, and we're also going to talk about the steps involved in bone repair. When it comes to this section, I'm more worried about you understanding the process of bone repair rather than being able to rattle off all the different types of fractures. In most cases, the names give you at least some sort of key, but if you're just trying to figure out exactly what to study, I might ask you questions about fractures, but I'm more worried about the bone repair. So let's talk about the fractures first. Let's start with the first two on the left, closed versus open. This straight up just comes down to whether or not the bone has broken through the skin. So in a closed fracture, the components of the break, all of the bone components are still within the body part. The skin has not been broken, whereas in open, we actually have a piece of bone jutting out. In a transverse fracture, we have the two forces being crushed, so we're coming together, so almost like a crushing effect where we have forces in opposite. So in this case, we have a force coming up through, from the foot up through the knee, also down through the hip. In the spiral fracture, we actually have twisted around, and so we have a fracture that comes from that twisting motion. On the comminuted, we have multiple pieces. So if you've noticed all the other fractures from the left up to this point, the break has caused two pieces of bone. But in the comminuted, we see that there are fragments, right? In this case, 1, 2, 3, 4, 5, 6, 7 pieces that this femur is in. With impacted, we have a force being applied in one direction to cause the break. In the green stick, we have what was probably like a bend, so if there was a force applied from one of the sides here that caused our bone here to bend and crack. It hasn't broken it all the way, but we have a crack in it now because of that force being applied that caused the bone to bend. That would be the green stick. And then oblique, we're talking about we have an angle, right, for the break. So if we look at oblique versus closed was straight across, whereas oblique, we're at an upward angle. So if something breaks, what's going to happen? You're going to have a natural process for fracture repair. Now, it's important to note this is going to happen whether or not you have medical intervention. And so it's very important that someone gets medical attention so that their bone sets correctly. This process will happen whether or not the bone is actually in the correct position. So that's important to note. If someone has a break and they don't get medical attention, they may end up with some problems from that. It may cause pain, it may cause issues with movement. And if the person needs it to be corrected, the correction involves re-breaking the bone, resetting it, and healing again. So let's go ahead and talk then about what happens in that fracture. The first thing that's going to happen is a hematoma, because not only did the bone break, but the blood vessels running through the bone also broke. This is going to happen in the first couple hours of when the bone break happens. Right, so the hematoma is the first thing to occur. The next thing that's going to happen are those new blood vessels are going to come in, and we're going to have what's called a cartilaginous callus form, right? So this callus here, this external callus that they labeled here, is going to be made of cartilage, and that will take just like a couple weeks. And then we get to the next part, which is to replace that cartilage with bones. We have what's called a bony callus form next. This also takes a few weeks to occur. So in this case, we're seeing spongy bone being laid down. And then after that bony callus, we have our healed fracture. We're going to go through remodeling continually. And so the last step is remodeling, where we're just going to keep going through the normal process of breaking down and building up new bone. And so we'll slowly see that fracture kind of seemingly disappear. We will probably still see some remaining evidence that there was a fracture there. In this case, you can look at the original bone over on the left, look at the one that's healed on the right, and we see that there's a little bit of a bulge there. It's changed a little bit in shape, but in general is still able to function. So that is something that can happen. In terms of how long this process can take and depend on which bone was broken and the seriousness of the break, we're looking at weeks though. This is weeks to months for someone going through this healing repair process.